Hello, Hannah and Annabelle. Yeah, I'm sorry I had to use my teddy bear because my patient I was waiting for keeps on getting stuck at work, and you've already given me the deadline to submit my demo. So I wanted to make sure I submitted my demo whether rain or shine with whatever I have. So I just went for my teddy bear and decided to use it so that you know I really need to pass this my course. So whatever I have to do, I will please do it. So that's why I use my teddy bear. So I'm very sorry for using teddy bear instead of a normal patient. So before I start with my assessment, I knock, I enter, I do my hand sanitization, and then I introduce myself. I'm Nurse Philomena. I'm here to do your neck, your heart and neck vessel assessment. Can you please tell me your name? She says she's Lucy Bachman. She says her date of birth is 6th March 1980. So she's about 42 years of, yeah, 41 years old. So she's African Canadian, and I'm checking around her room. It's neat. There's no mess around. I'm seeing her facial appearance. She's a very pleasant person. She has a very pleasant smile. Like, she's very kind to anybody, everybody. And as I was coming in and she was also coming in, I saw she was steady gated. She's alert and oriented 3 times, place, time, and person. And then now I'm going to assess her upper extremities. I know she has like cylindrical bouncy chest. I'm feeling her body temperature, it's warm. Her skin texture, it's elasticity and mobile. And her capillary, it's normal. She has a moist, not hydrated skin. She has a thick skin. Her texture is very soft. And then her abdomen, it's very tender and soft. I'm going to assess her lower extremities. Her, she has a very warm temperature. She has no lesions or scars. She has no bruises. And I'm checking for edema, pitting edema. She has none. She has regular skin texture. She's moist. She's a black skin. She's a black skin lady. She's African. I'm a Canadian, 41 years old. And then as I've done checking her blood temperature is 2, her blood temperature is 140/60. Her respirations is 12 breaths per minute. Her pulse rate is 50 beats per minute. And then as I'm talking to her, I'm checking her lightning. It's okay. I've given her privacy by drawing the drape around her. So now I'm going to check my patient's carotid arteries. These arteries are the major supply of blood to the blood vessel, to the brain, to the face, and to the neck. So now I've inspected it. I'm going to palpate with my 2 fingers. So I palpate here and I don't feel any bruit or swishing sound. And then I palpate here as she's sitting down. I palpate here too. I don't feel for any bruit or any swishing sound. So now I'm going to check for the jugular vein. The rationale behind this neck And then neck assessment is for the patient to be relaxed and then increases his or her cooperation with the assessment. So as I finish checking the carotid arteries, I'm going to check for the jugular vein while she is sitting before I put her in the 45 degrees position. So I check and I see, because I don't see it while she is sitting up. So I'm going to put her in the 45 degrees and then we will just see if we can find the jugular vein. So I'm going to check if I can see. So while I put her down, I can see the vein, but I don't see any distinction abnormalities with the jugular vein. So now I'm going to check the pericardium. I'm inspecting the pericardium. I don't see any abnormalities within the chest. So I'm now going to palpate. So I will use my hand to palpate the apical impulse. I'm checking for any hips or lift, which I don't feel any. And then I palpate the left sternal border for any murmurs which I don't find, and I check for the base to feel any trails, which I don't feel any. So after my palpation, I'm going to auscultate with the diaphragm while my patient is lying in the 45 degrees mood. So I use the diaphragm. This is the diaphragm. And then I start from the aortic to the pulmonic, to the eps, to the tricuspid, and to the mitral, and to the apical impulse. So I find the aorta on the second intercostal line. So I put the diaphragm, and then I draw it across the Lewy line to the pulmonic. But on top of the Lewy line, we have the suprasternal notch. So I cross to the pulmonic, I come down to the eps, and then to the tricuspid, to mitral, and to the apical impulse, which I didn't find any hips lift or any abnormality. And the apical impulse is on the fifth intercostal line, right across through the mid clavicle line. So after using the diaphragm and not finding any abnormalities, but I assessed the S1 and then the S2, which is the lab dub. The S1 is louder at the apical, and then the S2 is louder at the base. But I did not find any S3 or S4. So I'm going to let my patient sit up, and then I will use the bell to auscultate the Z line to find if there is any abnormalities. So I lift up my patient, and then I asked her to lean a bit forward and breathe in. So I put my bell on the aorta, right down to the pulmonic, to the eps, to the tricuspid, to the mitral, and to the apical impulse, which there is no abnormalities there through the mid-clavicle and the fifth intercostal line. So as I've done this auscultations, I'm going to flip my patient onto the lateral side and to assess for auscultate with the diaphragm to see if I'm going to hear any abnormal sound or abnormalities on that side. So I put my patient on the lateral side, and then I use the diaphragm to assess for any abnormalities. I did not find any abnormalities on the lateral side. So that concludes my assessment of the neck, the heart, and the neck vessel. And my findings through the auscultating, the inspection, and the palpating of the pericardium, I didn't find any abnormalities within the chest area. So thank you very much.